Hi. Hi, this is my first vlog of many to come. This one's gonna just be about the whole drug testing process in general. So as they stated before, drugs go through four different phases when become going through authorization. First a prime efficacy, a safety test, efficacy test, then a larger scale test to test for any negative results, and then a long scale test, where the drug is already being released and they're just testing to see long-term consequences. Uh, in some ways, I tend to disagree with this method, even though it's probably the best one that's in implementation at the moment. And the whole problem is that the fact that we're looking for effects in the long term after the drug has come out seems to me just to be a little, what's the word I'm looking for here? Let's say inappropriate, just because again you get cases like thalidomide, I believe it was, thalidomide. It starts with a T. The pregnancy drug, which they found out it basically caused birth deformations in children, the mothers who took it. And if they had just done additional testing in the beginning, it would have been easier to prevent the negative effects that occurred rather than seeing them and then having children, a whole generation of children that are missing limbs at the moment. But again, there isn't any really way to be able to really truly predict this, and so there's no really way to correct it, and it's more of a fault as our, not less of a fault of our drug system rather than we try to do what's best and we see if it works or not. Again, going back to as many times you mentioned before how they learned, many scientists in the early 80s learned that just knowing the mechanism isn't enough to supposedly be able to predict the actual effects of the drugs, even though, or how they're going to treat the patient, even though they're meant to trigger or treat certain effects within the patients. Um, Also, it just brings into question, let's say drugs like Rogaine, which is used for male pattern baldness, originally was used for treating heart conditions. How would you be able to, and eventually it was shifted off to help treating male pattern baldness once they found out that it had very little effects on the effects on actually treating heart conditions and more on just hair growth. At that point, is even though the drug is affected in something else, should it go through all the standards again to make sure it's all right, or are we just going to simply choose to continue it into the drug system? Oh well, okay, that's it. Thank you for listening. I'll get the next other ones to you as soon as possible.